Hey Josh, I hear that HUD has tweaked its primary homelessness assistance fund. What is up with that?
Yeah, so the federal government for the last, 10, 15 years has decided it wants to solve homelessness with a voucher. Those days are over, and the shift is way more than a tweak. It's the same as if you went to your car in the morning and all of a sudden it was a stick shift. That's how different the funding landscape is right now.
Sounds extreme.
Yeah, well, this is what's happening in the federal government, which means across the country, cities can't figure out what to do next. Their primary way to address homelessness is now gone. Now what?
Let's dive into it. Welcome to Untangling Knots, where we're going to explore solutions to help reduce homelessness from two very different perspectives. I'm KK, founder of Care Beyond the Boulevard, a street medicine program in Kansas City.
I'm Josh Henges, the most reasonable man in homelessness. I help cities solve the problem of homelessness. Today is episode 7.
The end of housing first. Let's untangle these knots.
Quick disclaimer, the views and opinions expressed on this show do not necessarily reflect those of my employer, my supporters, my friends, or my family. If you have a problem with anything I'm saying, come to me.
And the same goes for me. I think it's really important that we know that both of us have employers, both of us have employees, and our views do not reflect any of those. Our views are really just more thought-provoking. And the other thing is, Josh and I don't always agree on things. And the good thing is we can listen to each other. We can agree to disagree, but we can hear each other out and try to look at different ways, because what we both want to do is solve homelessness. And what we're doing right now in the United States is not doing any of that.
Yes.
So Josh,
Here we go.
Here we go.
Fun. This is awesome.
I know that this is really right up your alley and really something that you're invested in and interested in and trying to figure out how to work through these issues. So tell me what's going on with the federal government.
All right. So Housing First has been the way America has wanted to solve homelessness since 2009. In fact, it was the Hearth Act. Now, the Hearth Act is one of the rare bills going through Congress that had universal support. 0 no votes. Everyone was on it.
Happens.
This never happens,
Right.
ever. It's very, very rare. I feel like if there was a bill that gives all of Congress and Senate a raise, it wouldn't get as much support as this did, which is shocking. And here's the deal. Housing First existed coming out of a massive change in homelessness in what we call the modern era of homelessness. Homelessness is broken down into 3 eras. The Romantic era, the Skid Row era, and the modern era. And the modern era picks up around 1980. And does anyone know what happened in the 1980s with mental health in America?
Reagan closed down many mental health facilities. I know what happened.
That's it.
But for those of you who don't know what happened, it was a massive shift in homelessness in the United States.
Yeah, it defined what homelessness now looks like. So state-run mental health institutions were no longer going to be federally funded. They would not take Medicaid for anything inpatient anymore. So that meant all the folks that were inpatient are now outpatient, and many of them had nowhere to go. So where did they end up?
On the streets. And many of them had been homeless, or not homeless, I'm sorry, institutionalized.
Yes.
For a long time. We're talking
Exactly.
about people with significant mental health issues that really caused them to not be able to take care of themselves. We're not talking about, minor depression, minor anxiety. We're talking about major mental health issues that made it so they couldn't function in mainstream society.
That's it. And so homelessness used to look like maybe inconsistent employment, unstable housing, probably alcoholism. And when that shift happened in the 80s, that is the shift that took homelessness from that, the hobo era, the bindle, the riding trains, that era, on into severe persistent mental illness and substance use disorder, the type of homelessness we see right now. So America needed a different tool to address homelessness. The homeless system at the time wasn't doing it. And a guy named Dr. Sam Simbaris in Brooklyn, New York, he was a psychiatrist in a state-run facility. He saw firsthand the impact of these Medicaid cuts. Firsthand. All of his patients are now living outside on the wall in front of the place he worked, where they used to live.
Right.
And he said, we got to do something about it. He's the one who invented Housing First. And Housing First was profoundly successful in the trial runs because it was surrounded with support. Not only did you get housing, you got all of the wraparound services, so it was profoundly successful. So in pockets across the East Coast into Canada, you had successful housing first interventions. George W. Bush was the first president to say, maybe we should try that. He said, we're going to end homelessness. He didn't get there quite yet. Insert the Obama administration. And in 2009, the HEART Act was introduced, and Housing First became the way the federal government was going to end homelessness. And they believed they were going to end homelessness. And right now in 2025, have we done it?
We have not done it yet. One other thing I want to point out, though, to you, that in the 80s was also the beginning of the opioid crisis.
Oh, yeah.
Right? So we cannot forget about that. We cannot forget about, I was a nurse in the 90s, and in the 90s, they introduced the fifth vital sign, right? It used to be blood pressure, temperature, respirations, and pulse rate, and then they added pain. There's a lot of controversy surrounding this, that the fifth vital sign was really promoted by big pharma and the opioid producers. And so we had this kind of like effect of closing down mental health facilities, and now this rampant availability of opioids.
Yes.
So we really have two things that came together at the same time that were catastrophic for people who were on the fringes of losing housing or who had mental health disorders that required them to be institutionalized. So I don't want to, from a medical standpoint, I don't want to leave that part out because I think it's very important in the evolution of where we are today with homelessness. So, okay, so you talk about the HEART Act and the Housing First.
Everyone loves the HEART Act. I mean, they come up to me all the time and talk about federal legislation.
No, they don't. But anyway, so okay, so we have Housing First, and what in the past, so that was 2009, it's 2025 now. So in the past 16 years, what has happened with Housing First?
This is what's interesting. Housing First was rolled out nationwide, and it was rolled out and implemented so poorly. It's should be on the list of things to research and one of the poorest executions of a plan. So the thought around Housing First was simple. Housing should be the first and only step to addressing someone's homelessness. So the federal government said, that's all we're going to fund. We're going to fund vouchers. We're not going to fund shelters. We're not going to fund transitional living. The behavior of the person is irrelevant. Once we get them into housing, that's all that matters. And here's the problem with this process. A voucher paid for housing, but a voucher didn't create housing, which means a voucher is useless without a landlord.
Right. But you have to have landlords who are willing to accept those behaviors that are sometimes difficult to manage, whether someone is living inside or outside. It can cause someone to damage property. It can cause people to invite maybe individuals who we wouldn't normally want in that neighborhood into their homes or their
whatever they were doing outside, they're going to do it inside
because of support.
Yeah, and that's the deal. So like if your worldview says just house them and it'll fix the problem, what you're going to get is a housing support system without the support.
So tell me why it was so successful on the East Coast and up into Canada. Why was it so successful there? But then when we implemented it nationwide, what was our downfall?
So when you look at interviews with Dr. Sam Simbaris, he will tell you what made it work was the support. Was the medical support, was the case management support, the fact that you were going to that apartment or that house every single day to check on folks.
So what you're saying is when they implemented Housing First and the vouchers, they were paying for the apartments and paying rent, whatever, but they weren't paying for the supportive services.
That's exactly
what
right.
we in homeless case management call wraparound services.
Yep.
So we want to do Housing First and we're going to pay for this, but we're not going to support what makes it work.
That's exactly right. And
Okay.
and here's the deal. At some point in your career, whatever career you have a decision. Do you want to support the system or do you want to support people? And Housing First became an ideology that you supported because it told you you were also supporting the people. But here's the deal. In support of that system, you had to remove the most basic logic that you have to solve any other problem. And this is what this mystical thing that Housing First did to people. Keep in mind, I did a TED Talk on Housing First. I was mystified by it too. I was there. I was present. I imagine you were. Many folks, the dozens of listeners we have might be there. Housing First was introduced in Kansas City. It was a big room. We all got in there. A guy named Ian DeJong from Org Code. You can still look up Org Code in Canada. He came in and he told us all about Housing First, and it blew our minds. We loved it. We couldn't believe it. But one of the things he kept saying was this: when you house someone, if they destroy that unit, what do you do next? Well, you house them. What if they destroy that unit? Well, you house them. So, I mean, it's elephants. All the earth sits on the back of an elephant. What does the elephant stand on? Another elephant. It's elephants all the way down. Well, here's the deal. Unless you own the housing market is not going to put up with that.
Right.
And one of the things we did in the rollout of Housing First with these vouchers, we had to determine something. We had to decide, who do we give the voucher to first? It was always going to be a supply and demand problem. There's going to be more demand than we had supply. So who do we give the vouchers to first? Well, in the world of homeless services, we did the noble thing. We said, let's give the voucher to the person who is having it the worst on the street, the folks who are the most vulnerable. So we created this test.
The test that actually was originally created to determine someone's likelihood to die. Like, that's not a lie. That's exactly what it was. The test that we still do today.
Yes.
And it's a vulnerability score. So the people who are more likely to die are going to get housed first. Now, the thing about that is you don't want people dying on the street.
Sounds noble.
Right. Except for then someone else has to wait until they're about ready to die to get housed. It makes no sense.
And the other thing is, remember, vouchers don't create housing. It just pays for it.
Right.
So what did landlords figure out very quickly? The people that had a voucher were people they would never rent an apartment to. But the voucher holder said, this is who we're going to give it to. In fact, the federal government said, you must do it this way. So across the country, every city that got federal funding had to do a test. If you wanted to give the voucher to someone, you had to do an assessment, a test, a vulnerability assessment that measured how likely you were to die outside, which means you are going to exhibit the most chronically homeless behaviors.
Yeah.
And you will be rewarded with a voucher. And then we put these people inside with no wraparound support. What do you think was going to happen? And it did.
Yeah.
And landlords across the country en masse said, I'm not interested in this.
Right.
And then the ideology of Housing First told you landlords are bad, then. They're evil. Because the world of homeless services thinks the housing market belongs to them, apparently, or that the housing market is an arm of social services. It is not. In America, housing is not a human right. I am sorry. I don't know what to tell you. I see people holding signs, housing is a human right. No, it isn't. I wish it was, but it's not. Go to a property manager.
If it were, so let me clarify something. You're not saying from your perspective that it's not
I'm saying
right.
real life
And
it's not.
The reality is, it's not a human right because we have people sleeping on the streets.
Well, I don't know why that's complicated. It's not
I know. I'm just saying, like, that's not your view. You feel like everyone should be housed.
My views are relevant.
Exactly, because the reality is, it obviously is not a human right because we have people sleeping outside. So
Yes.
let's get to what's going on right now in the United States with Housing First vouchers.
Fascinating.
They're being slashed, like literally slashed by the government. Not cut in half, right?
No, they want to do away with it.
Right. So the funding that cities, municipalities are getting as of this year are being cut to 30% of their funding.
Yes. So if it works like this, the federal government every year gives your community amount of money based on the homeless population that you have. Now, the way they count is terrible. So we can talk about that later. That's not how they're going to do it anymore. So traditionally, and this is where the impact of these voucher cuts are going to come in. Let's say the government gave Kansas City $10 million a year. It's more than that. We just want to make it easy.
Right.
9 of that 10 million is going to vouchers. But here's the deal. It's not $9 million to give vouchers to folks who are currently homeless. 85% of that 9 million goes to pay for people who are already housed, people we've already given a voucher to, but we got to continue paying rent from years ago.
Right.
This was an unsustainable model from the beginning. It's a charitable Ponzi scheme.
But it's a model that the vast majority of communities rely heavily on.
Yeah.
Well, most communities get more than 75% of their housing support from these vouchers. Like, we just want to make sure you understand, like, the how much this affects people in the United States. The other thing.
Hold on, I need to finish this thought.
Sorry.
So that 85% that we're paying for people who are already housed, that's where the cuts are going to impact. So the cuts aren't necessarily really, in terms of like, there's a pie chart of impact. Folks who are currently homeless aren't going to feel that. It's the people who are currently housed because we have done nothing to prepare them to take over rent.
Estimated numbers are 120,000 people in the United States are going to lose their vouchers that they currently get. Now, a couple of caveats: people who are disabled, who get disability, and people who are over the age of 65 are going to be exempt from these cuts. One of the things that HUD does or has done, I'm going to be interested to see what they're going to do moving forward. So when you're working on a voucher for an individual, HUD does this disability determination. Now, being in medicine, when I first started working in homeless services, when somebody said, oh, they need a disability voucher, I'm like, we can't do disability verifications. But disability, according to HUD, prior to now, also included any type of mental illness history and a substance use disorder. So that's being cut.
That's out.
Right. And so the 120,000 people in the United States that we're talking about potentially losing their vouchers, number one, because of the funding cuts, but also because of that little line in there that substance use disorder is no longer being included as a disability per HUD, and the people who got housing based on their history of substance use disorder are not going to be eligible for those vouchers any longer. So I think that it's important to know that 120,000 people in the United States who were previously homeless now have no support. The problem that I see with these cuts, I'm not saying we don't need another system. Obviously, this is not sustainable. The problem I have with it is the amount of slashing that is occurring all at one time. It is devastating to every community in the United States. So that's where me personally, like seeing people that we have gotten housed and have been off the streets for a while now, what's going to happen? They're now going to come into homelessness again. And maybe they, have gotten, gotten through recovery with their substance use disorder. Living on the streets is tough.
It's horrible.
It's horrible. And not everybody who goes on the streets is there because of a substance use disorder, but there are a lot of people who live on the streets who have a substance disorder. Substance use disorder. So, which came first? So, I think that the effects are going to be devastating to communities. I'm not saying, okay, we don't need something else. I'm saying the way that this is being done is harrowing.
Yeah, it's going to be brutal. Communities are going to feel it. They're going to have to come up with a plan. I'm kind of robotic. I take things as they are, and I want to plan and implement and strategize based on I always say, you got to solve problems in the reality that you are in, not the reality you wish existed.
Right, exactly.
You can build the one that you wish, but until that's the case, we got to solve it here. The way that the cuts were happening, they're really fast. My frustration is I don't understand why communities didn't see this coming. This was an unsustainable model. And when you get someone into permanent housing, the goal of ending someone homelessness shouldn't be we got them a voucher. The actual measure is that person can take over rent on their own. That is the goal of addressing homelessness. And we completely ignored that in the Housing First era.
Let me ask you, do you think, I'm not going to say it was completely ignored. I understand what you're saying. But do you think some of the reasons it was not dealt with was because of the lack of support for supportive services?
Yeah, I'm not blaming the federal government for that. You got to raise your own money for that. The goal shouldn't be we gave them a voucher. That's it. And look, I have someone on my team who was told face to face from my entire team's full of folks with lived experience. She qualified for a permanent supportive housing voucher. And the housing voucher case manager person said, you can have this for the rest of your life. Yeah. That is what she was told.
Yeah.
Which means there is no emphasis on you being prepared. So when that valve gets shut off to this money, and these people were told, you don't have to do anything, the government's going to pay forever, those people need to take responsibility for this because that was never going to be true, ever. And what's amazing about supportive housing is that the overwhelming majority of folks, and it doesn't matter their starting point, 95% of folks who are safely in supportive housing within 2 years don't need support anymore, and they won't become homeless.
If they get supportive housing.
Yes, that's how important supportive housing is. You got a 2-year window to really get in there, but without case management, without health care, it's not going to happen. So instead of surrounding these folks we put into housing with that support to be able to recycle those vouchers for new folks who are experiencing homelessness, we just said, we'll keep paying rent forever.
Let me ask you a question. So, because through the years, I've taken care of a lot of people who have gotten out of homelessness. Many of them have not returned. I have a guy who I still talk to. He texts me. He literally reminded me yesterday that his 4-year anniversary of being off the streets after 20 plus years of being homeless is coming up. Now, here's the thing. He had supportive services. Yeah. He had a case manager from another agency. I mean, we don't house, but they housed him. They still follow up with him. Like he had his 1-year person and then he got another person. They still, like he texted me yesterday, he said, my case manager couldn't come today because of the weather. But I think like you look at him,
yes,
right? And he now has, when he first got off the streets, he didn't have an income. He didn't have disability. He needed it, but he didn't have a consistency enough to be able to apply for disability. He has since applied for disability. He got it a year ago. He was homeless. I mean, he was housed for 3 years before that's how long it took to get his disability. He relied on, the only support he had was the HUD voucher and food stamps. Yeah. And then he has cats. And so we would help him with his cat, with the food and the litter for his cats, because that's very important. Right.
Do it.
So, but he's a really good example of how supportive services work.
Yeah. That's a great example.
It is a great example. I have lots of examples of where people haven't, and they haven't seen their case manager, or the case managers. Now, I want to ask an opinion question, because we all know Josh has got opinions.
I'm very judgmental.
You are. But do you think with, so we know things have got to change. One of my thoughts is sometimes we have agencies who get a lot of money, and they're doing great work with housing, but their supportive services are not as robust as they need to be to keep people housed. Do you think that, and don't shoot me for this, not you, but whoever's listening, do you think that we would be better off having less agencies, smaller amounts going to more agencies who then can provide those wraparound services? Because what we're missing from some of the work is supportive services. And so if agencies are having to raise their own money, and raising money as a nonprofit is really, really hard. But do you think maybe less money to less money to more agencies to then provide those wraparound services, so you don't just get drowned in vouchers?
Yeah, I think what's tough is it is a really hard thing to sign up for as an agency, to be the steward of these vouchers.
Absolutely.
So the way the government does it is they give your community a pile of money, and you are to convert that money into these vouchers. And it depends on which nonprofits sign up to say, hey, I want to help distribute these vouchers. But those funds don't come with supportive services. No. It only pays for housing. So any nonprofit that says, I want to help distribute vouchers to homeless folks, they are on the hook for not only finding an apartment, but doing landlord recruitment. And now we're adding, you got to do wraparound services. Nonprofits, they do not know how to have this capacity. And I think you're 100% right. If we don't spread this out and nonprofits start to merge and combine, it's never going to happen. The entire homeless system, the entire infrastructure of it, is not going to solve homelessness. It is still too grassroots. It is still too siloed. The more nonprofits can surround each other, the better. So it would actually be way easier if there was a specific nonprofit that raised funds specifically to do wraparound services for nonprofits that do the vouchers. But that's not how nonprofits think.
Well, I think one of the things, the way homeless services work, just the core of it, we'll talk about the HUD NOFO, which is the Notice of Funding Opportunity. It's a competition.
Yeah.
You have a local competition where all of the nonprofits who want to compete for the money, they, as you said, throw their hats in the ring. They submit these things, and then they make it a collaborative effort from a community, and then it becomes a national competition. It's a competition. And at my core, I have a little bit of a problem with that, because I want agencies to work together, right? I want agencies to collaborate, because I feel like collaboration is the key to ending homelessness. Because what one agency does really well, the next agency might not have any experience in.
Or they're terrible at it, and we tell them they're great because they're doing nice things, which is what we always do.
That's what we do, because we
don't. If you're helping, we don't want to tell you you're doing it wrong. When so many nonprofits are doing this terribly, and we have just this aversion to being honest with them. And then when you are honest, you get yelled at.
I think part of that
drives you insane.
I think part of that is because it's a competition, and they can't.
No, it's how the money works.
Right. No, that's what I'm saying.
The money completely prevents you from working together. It's not possible to solve homelessness the way the money is distributed now. This grassroots network where every nonprofit is screaming about how great they are, and if they yell the loudest and have the coolest sign, they get the money. That is not how you solve any problem. There's no measure of efficacy there. No one's checking your data. You just say, I work with 10,000 people. Let's give them the money. Right? You know. They don't know. Right. No one's checking, because there's no system to check any kind of outcome.
Yeah. So that's heavy.
Yeah. This is
it's a lot. And it's disturbing to me the way it's happening.
Here's what I always say.
I mean, you're not surprised. I know.
No. And what do? You adapt. You have to adapt. Like, I don't want to hear the complaining. Like, I'm done with the complaining. Us complaining, we go home at night.
Yeah.
People are outside right now, and we're complaining, oh, this is hard for us. I don't want to hear it. We need to step up, because we are doing it for them. And remember that every time you go home, they don't.
Right.
So are you working hard enough to get them off the street, or are you worried about how you feel about the federal government and how they want to fund? I don't want to hear it. Get to work and adapt, and we must. Right now, supportive housing is being cut. So what do we have to do? We got to find a way to keep those folks housed.
Yeah.
That is what we have to do as a community. Complaining ain't going to get us there. It's not. Yelling isn't going to get us there. We have to find a way to do this. The other thing we have to do is we have to wrap our minds around the idea that behavior change is now central to addressing homelessness from the perspective of the federal government. If you want their funding, behavior change is at the top of the list now. That is not ideologically aligned with housing first, which means you have to decide, are you serving housing first ideology, or are you serving the folks out here? Because I guarantee the city you live in needs the infrastructure that the federal government wants to fund right now.
Right. It's not an option.
Not an option.
I mean, it's really not an option. We don't have to like it. I mean, I remember when back in March, maybe February, March, when they were talking about wording that was present in government websites and on nonprofits and health equity and
email signatures and pronouns.
Exactly. You don't have to like it, and you also don't have to change the work that you're doing, but you have to make sure that you're serving the people that you were meant to serve. And the thing is, you can serve people that you were meant to serve without all the fluff of the words.
Yes, you can.
You don't have to change how you're serving people.
Nope.
You do not have to do that. You can continue. You can continue to.
You think removing pronouns on your email that has anything to do with how you're going to serve? Get over it. Get over it, and let's get to work.
There are bigger fights. There are bigger fights, and
don't
the
let
fights
that be your
are
Alamo.
people outside dying. As you said,
that is the issue. Stop taking the pronouns parts like so personally. Like it's not about us.
Right.
We have to set. Do you know how much I don't like about any of this?
Yeah.
It's irrelevant.
It doesn't matter how we feel.
It can't matter.
I mean, again, I'm not trying to sound cold. That's not my personal feeling, but that is the way that the world is working where we are right now. It doesn't matter how we feel about it. What we need to do is figure out a way to continue doing the work that we're doing, because the work that we're doing is good work.
Yes.
And continue how to make it so people aren't being put back onto the streets and people are being taken off the streets in a good way.
Yes.
So, you're right. I think that's very important. Do you have any other thoughts on this subject?
I have 1,000 other thoughts.
Any other things that you want to say today before we get to your favorite part?
So the the one thing that drives both KK and I think it's important to understand this, we believe that you can actually end homelessness. We genuinely believe that. So our starting point is that's the goal.
Yeah.
So when we see anything that doesn't smell or look like or sound like that goal, we have an aversion to it and we're going to call it out. The goal is ending homelessness, and it's going to evolve and change, and we're going to have to adapt to it, but we have to.
Yeah,
It's
we
not
do.
about us.
It's
We
not
have
a
to.
choice. Not about, you're right. It's not about us.
That's it. All right. I think we need to move on to the best part, which is ask the expert.
Now, let's just say that for those of you who are listening, you can always send a question in.
Yeah, we want your questions.
We want your questions.
We will
because
answer them.
Jackie has to come up with questions for us. And she does a great job of it and has some great questions. But we also want your questions when you're listening to this podcast, even if it's a question about, obviously we record these in advance. So it's a question about something that we discussed at a previous podcast.
We'll go back.
We'll go backwards.
Yeah, and if you have ideas on what you want us to do,
Yeah,
show
what do you
about,
want to hear about?
we'll do it. We love it.
Yeah. So we want to make sure that you subscribe to the
Why
Untangling Knots.
wouldn't you subscribe? If you listen
I'm
to this
subscribed.
long, I'm subscribed. I'm a strong subscriber. I want you all to subscribe and tell 10,000 of your friends. By the end of this month,
Do you
we need
have
100,
10,000 friends? You don't have
12,000.
Okay,
I
my
can't
12
imagine
friends.
having
My
5
12 friends are subscribed. No, so subscribe to our podcast. Please listen to it. Share it with your friends, as you said. You can listen to it on the way to work, or you can watch the YouTube where you can see us.
Yeah, I do YouTube. That's how I do my podcast.
Yeah, I don't
That's
watch, but and then we also have to give a shout out to Solomon Shields and Jackie Lamer. They are our producer and our director.
Amazing people.
Amazing people.
Genuinely.
Nice. Yes. Questions, Jackie?
That
What
was
you
great.
got?
Microphone, please.
Oh, sorry.
So, Josh, besides Josh Shapiro, who are some other national advocates working on this issue?
Okay, so the best author on the topic of homelessness is a guy named Stephen Ide. Stephen Ide wrote, in my opinion, the best book on homelessness that has ever been written. So if you want to get a primer, what I would do is I would Google Stephen Ide, E-I-D-E, I believe is how you spell his last name. It's real. If you do that and Stephen, you're going to find it. He's going to pop up. Listen to one of his lectures. From there, you will decide if you want to get his book, which is the best book on the topic of homelessness. We're talking about national advocates for homelessness. They come and go, and that's the thing. Homelessness is very political, very. And you're going to get tons of support when you have a certain group of politicians in, and then it wanes when a different group comes in. This is why you see cities get really good. Salt Lake City is a great example. They actually achieved functional zero. They ended homelessness in Salt Lake, and now they didn't. Why? Because the political winds started to shift in another direction. So unless ending homelessness is institutionalized in the organizations, the nonprofits, and the funding mechanisms of your city, it's just going to change if we keep hanging it on the rack of politics. It's a great question, though. Stephen Ide, listen to him.
Sounds good. KK, you are a nurse practitioner, and 10 years ago, you started a robust street medicine nonprofit. So how much of your medical training prepared you for the mental health issues you deal with today? And how much of it did you learn literally on the streets?
So, yeah, that's a really good question. Ironically, I did try to go back to school to become a psychiatric nurse practitioner, but I had to, because I was working full time, I couldn't do my clinicals at the same time. So my training
It's absurd.
It
Your
is
life.
absurd. Yeah. So my training helped me with the basics. The thing that I always say about the medicine that we practice in street medicine is the medicine itself is really not that difficult. It's the comorbidities, it's the complications, it's the barriers to access to care that really make this difficult. And those are kind of the mind benders of what we do.
Will you do an example of that? That's such a great answer.
Yeah. So when you talk about, for example, we have patients who are diabetics who are living on the streets. And when you're living on the streets and you have mental illness and you're a diabetic and you need to take your medication and it gets lost, it gets stolen. People with mental illness living on the streets often, if they have like problems with anger. They are in fights often and they lose their things. And so what we'll do is we'll find creative ways to help them get their medications. We have had more than one patient who was living outside, who had severe mental illness, who was diabetic, who would come in and we'd give them a weekly injection. Now it's not insulin because insulin has to be daily.
All the time.
Right. But there are other medications if they're not a type 1 diabetic that they could take. And that can help control that part of their life. We also have patients with pretty significant mental illness who maybe the psychiatrist has seen and has recommended a long-acting injection of an antipsychotic.
Yes.
And they can come in and get that from us because they can't carry it around with them. Getting to their psychiatrist's office is sometimes difficult. They can drop in with us. They know, oh, it's about the first of the month that I need to be in and get that. So I don't think that medicine prepares you, like being in medical school, being in NP school, it doesn't prepare you for the vast amount of gray areas that we see. And it's so funny because just yesterday I talked to 2 different street medicine providers that are friends of mine, one in Pittsburgh and one in St. Louis, about an issue related closely to this. And like, what are some ways that we can help people with medication adherence when they're living on the streets, when it's difficult to get their medications? And so coming up with creative ways that you don't learn in school about how to take care of people. So you learn the basics, but that's true of medical school and nursing school and nurse practitioner school. You learn the basics. You learn what you need to know. What you really learn about taking care of people is by taking care of people.
Yeah.
So it's a great question. And it's there. Obviously, the education is great. The base education is great, but it's really learning about each individual. And I think the other thing that about what we do, it is our care is individualized to the patient.
Yes,
our patients are not cookie cutters. And every what works for one person as far as coming in and getting an injection once a week or whatever it is, once a month, once a quarter, or we have patients that we can give 2 weeks worth of medications for and they'll be okay. So every single patient we know, like, we need to do this to help them sustain, to keep their health improving, to keep their mental health on track. So that's a really good question.
That was a great question.
Awesome. So join us next time for Untangling Knots, where we're going to continue to explore the challenging realities of homelessness without the sugarcoat.
We're going to be honest and we're going to keep it real. Thanks so much for watching and subscribe.